Anthony.
Hey, Dr. Yu. How you doing?
How are you?
Anthony McBride is 54.
Sit down.
Okay.
He's been living with diabetes for almost 12 years.
Tell me about your medications. You're taking insulin every day.
Yes, I am.
At what time?
For 10 of those years, he's been seeing Dr. Guillermo Umpieres, head of the diabetes clinic at Grady Hospital in Atlanta, and a leading expert on diabetes at Emory University. Someone like Anthony, when you're talking to them the first time and outlining this stuff, what is the reaction typically? Do you get the sense that people are motivated to at least try, or?
What is interesting about Anthony is that he had a very good diabetes control. He also has hypertension, now has some kidney damage and some heart problems. Diabetes is the #1 cause of blindness in the world. It's the #1 cause of kidney failure and need for dialysis. It's the #1 cause of loss of a limb or amputation of the lower extremities.
What typically ends up happening to a patient with diabetes?
The #1 cause of death in patients with type 2 diabetes is cardiovascular complication. So a heart attack, stroke, problem with circulation in the leg, heart failure. Tell me about the vibration. Can you feel it?
Nope.
One of the things that patients are told to do is to examine their skin and particularly their feet. Well, why is that?
This is because many patients with diabetes develop peripheral neuropathy or nerve damage. So if they have a little cut, if they have an infected toenail, they don't have pain.
The thinking seems to be among people that type 2 diabetes oftentimes is a result of poor choices. Is that true? Is that a fair assessment?
It's partially true, but genetics plays a significant role. But not every obese person develops diabetes. So that means that the genetic predisposition is extremely important.
You know, I remember my dad's diabetic, and I remember when he was diagnosed, our diet and our whole house changed. Even us kids had to eat a different diet once that happened. Everything changed in our lives from that moment on.
Family support is a key for the success of diabetes treatment.
You've been doing this for a long time. Has it gotten a lot busier? I mean, you've seen more patients?
Significantly. So the epidemic of diabetes, there's about more than 30 million Americans with diabetes right now. We have about 70 to 80 million people who are what we call pre-diabetes.
If you start to do the math on that.
Yeah, 1 in 3 Americans over the age of 20, especially over the age of 40 or 50, will have diabetes.
This is an epidemic, as you say, diabetes. You've seen it through several decades. What kind of grade would you give the medical establishment?
We have done much, much better. In this country, the rate of complications and death related to diabetes is coming down. Well, we have not been successful in preventing the development of diabetes. What we do right now, hopefully, is trying to prevent the appearance of diabetes and the appearance of complications of diabetes, or when they appear, try to treat them aggressively early on, trying to prevent the end stage of the complication of diabetes.